Good afternoon, everyone, and welcome to the Shelby County Joint Task Force update. I hope that everyone had an enjoyable and healthy Thanksgiving holiday. I'm going to give data updates as we typically do, and then Dr. Randolph's going to join me and give some additional updates, and then we'll open it up for questions. We are in the middle of the fall surge. We predicted some weeks back that we saw a foreshadowing of a very challenging fall, and we are in the middle of that. We appreciate all the efforts that this community has taken to reduce the transmission of COVID-19. However, we do know that we will have some challenging weeks ahead. We'll continue to give updates on Tuesdays and Thursdays. Our goal is to continue to do everything that we can to reduce transmission so that we avoid additional restrictions across our community. As of this morning, we have 48,714 cases. That's 609 new cases in the past 24 hours. And we know at the current time we've experienced 672 deaths. We still continue to have a mortality rate of about 1.4%. We have typically had a death rate of 1.4 to 1.5%. Again, that is much better than the rest of the country, and that is a testament to the healthcare systems that we have locally and the ability to provide care to those who need care. What is important at the current time, we know that we have 3,730 active cases. So that means today there are almost 3,800 people in our community who have active COVID disease. Those are the individuals we know about, but there may be others who are asymptomatic, which then increases that number significantly. We continue to look at the ages of those who are infected with COVID and how that impacts our local pandemic. And what we know is that the majority of individuals continue to be under 34 years of age, but the highest group with infection are those from 25 to 34. And so while our messages really are to the full community, we want those who are most at risk to really heed the information that we provide. In addition to that high group of 25 to 34, 35 to 44 is the next at-risk group. Those are individuals that are more likely to be in the workplace, more likely to be engaged in social activities, as well as more likely to be potentially going to school. We started in mid-September gathering additional information from cases that would allow us to better tailor any interventions that we have to take locally. So I wanted to share some information that we compiled recently that was for the month of November for 303 case interviews that were completed. We do know that about 49% of those individuals continued to engage in activities of daily living while they were infectious. And the types of activities that they engaged in were, one, they continued to go to work. So 76% continued to go to work while they were infectious. And for this number, they may or may not have been symptomatic, but our previous data indicated that about 4 out of 5 people do have symptoms locally. We know that almost 40% continue to engage in social or public activities. That could be things like shopping, going to a restaurant, visiting with friends, and so on. And then a much smaller percent, 3%, continue to engage in school-related activities.